Lara Gutsparami, the Swiss World Cup alpine ski racer and the Super G champion who won a gold medal at the Winter Olympics in 2022, will unfortunately miss next year's Winter Olympics and the rest of the season due to an incident that occurred in Colorado in Copper Mountain. She sustained a complex knee injury and a concussion. I'm Monica, I'm a sports physio, and I'll be breaking down this incident that has occurred for Lara. She has had an MRI that has confirmed that there has been a torn ACL, meniscus and MCL. If we have a look at the footage, Lara's going downhill and she's a little bit off balance where her right leg is then drifting outwards away from the centre of her mass. This then means the left ski is loaded a lot more and it moves from its outside edge onto its inside edge, and then this inside edge catches onto the snow and this forces the knee to move and rotate inwards, and this is a position where the ACL is under a lot of strain and it can tear in this position. This is what we call a dynamic snowplow mechanism and is one of the common ways that an ACL injury can happen in skiing. Other ways we can see an ACL injury in skiing is what we call a slip catch and landing back weighted. Now Lara has also injured her MCL and her meniscus, and so when you injure all three, so your ACL, meniscus and MCL, that is what we call an unhappy triad injury. If we have a look at the anatomy of the ACL, it is a ligament that's within the knee joint that's designed to prevent excessive sliding forward of your tibia, which is your shin bone, in relation to your femur, your thigh bone. It's got two bundles, your anteromedial bundle and your posterolateral bundle. MCL is your medial collateral ligament that's located on the inside of your knee, and it helps to provide stability to your knee from sideways movements, particularly into what we call a valgus position, and it's more loaded when your knee is in a straighter position. Whereas your meniscus is a shock absorber and provides cushion and stability for your knee, and it can commonly be injured during twisting mechanisms. Now, just because your knee moves inwards into that knee valgus does not mean that you're going to do your ACL. There's lots of other things that are needed and lots of other factors that are involved. For example, if there's a high ground reaction force and there's a lot of quad forces happening and your center of mass is not in the ideal position, and you're combining this with your valgus force and your knees only slightly bent or your shins rotating away, all these combined can contribute to such an injury. And with Lara, she was going downhill, which is a lot of quad force that's needed, and then she wasn't in the ideal center of mass, and then her ski acted as a lever to twist her knee as well, and she was in that knee valgus position. So all these factors combined in that mechanism would have contributed to the ACL, but also other structures like the MCL. Now, I don't know the exact conditions and circumstances in Mount Copper, but what we do know that can contribute to an increased risk of ACL injury is if there's bumpy conditions or if there's fresh, icy or grippy snow. There was a recent study that was done in recreational skiers which showed that if there was fresh snow, the fresh snow can hide bumps and icy patches, and if there's icy snow, it can cause the ski to catch and slip more easily, which can all lead to that twisting of the knee. Having reduced visibility can also play a role, but there's also other factors that we can't necessarily modify, such as if there's been a family history of ACL injury, your genetics, and even if you've had a previous ACL injury. We know that Lara has had ACL reconstruction on her left knee back in 2017. And it's interesting too, like across multiple sports, it is known that females are more likely to sustain an ACL injury. However, when you look at the alpine skiers at like the World Cup level, so your highest level, they actually found that it was quite similar between males and females. Now, moving forward from the incident, Lara is due to undergo surgery, and so she'll be having lots of discussions with the team and the surgeon regarding the ACL reconstruction and what kind of graft they're going to use. And they'll likely be addressing meniscus with meniscal repair, but there'll also be discussions around the MCL. Lara will be in a hinged knee brace where the surgeon will decide how much range they want at that knee. They will typically limit the amount of knee bend, so knee flexion, mainly for the meniscus, and they'll restrict the knee from going into full extension to take stress off the MCL. It'll be really important that Lara does a lot of quad activation early on, because the quads can be inhibited after this kind of surgery, so trying to make them contract often throughout the day. And there's lots of strategies you can use to help get the quads firing too. So there's like neuromuscular electrical stimulation, you can use blood flow restriction as well, and there's been lots of cross-training methods that are out there too, where you're then strengthening the other side, which will then help to stimulate the affected side. It is important that as she progresses through all the phases of her rehab, that the knee remains calm and doesn't flare up with much pain or swelling. Before Lara gets back to perform, she'll go through a return to sport assessment, so she'll need to make sure that she's got adequate range, strength, balance and control, proprioception, good agility, that she can jump and land well from various directions, and they'll just check her vestibular system and make sure that she's psychologically ready and confident with her knee and to go back to perform. And continuing with neuromuscular exercises may have an effect to prevent re-injury. It is important to look at the whole person, as ACL injury is so complex and there's still so much research that's being done out there. Lara mentioned before the injury that she was planning to retire after the 25-26 season. However, she was recently saying that she will wait to see what the future holds after the injury heals. There was actually a study that was released last month that reported a strong return to pre-injury performance in professional alpine skiers who had ACL reconstruction, and this was in various disciplines. If you look at the female group specifically, the mean time to return to competition was between 8 to 16 months, and then 63% of females managed to return to their pre-injury performance. However, they did find that the outcomes varied if there was multiple injuries involved in the athlete, so if it wasn't just the ACL. She has been through an extensive rehab journey previously from an ACL injury back in 2017, so she knows exactly what it takes, although this will be a bit of a longer process as a meniscus is involved this time, so depending when she ticks all the criteria, it could be at least a 9-month process. We hope this won't be the end, as no athlete wants to end their career after an injury. I mean, Lara has accomplished incredible things in the speed and technical disciplines in her career. Now let's see how Lara goes, and hopefully she can bounce back. Thanks so much for listening. If there's any other athletes you would like me to analyse, please just pop it down in the comments.